Next up, we have a keynote speaker, Trace Terrell. He's a 20-year-old public mental health activist from La Pine, Oregon, a Kessler Scholar at Johns Hopkins University, where he studies public health and writing seminars with a hope to pursue a career in mental health policy and management. His current research examines transnational relationships and crisis intervention services. Trace is a current NAMI Next Gen advisor and a member of Active Minds and MTV's Ask, Acknowledge, Support, Keep in Touch Youth Leadership Council. He is also a part of MHA's Youth Policy Accelerator and the 988 Suicide and Crisis Lifelines You Matter Blogger Council. Trace has advocated at the White House, the SAMHSA Center for Mental Health Services, and before the United States Senate Committee on Finance. His work has been featured on NPR, C-SPAN, and Bloomberg, among others. His interest areas are peer support, school mental health services, workforce development, and adolescent crisis intervention. For fun, Trace loves to hike and explore Baltimore and Washington, D.C.'s food scenes with friends. He also has a really mad two-step, so if he's going to show it to us today, he totally should. Please help me welcome Trace.
Well, thank you so much for that wonderful introduction. I'm really excited to be here today and to share a little bit about the independent research that I've been doing at Johns Hopkins University. It's, like Corey said, about transnational movements for crisis intervention services, and that at first glance does not sound like the most interesting topic, but I tried my best to make it as engaging as I could. So we'll go ahead and get started now. So just as a little overview again, I'm a Kessler Scholar at Johns Hopkins University. I'm also a part of some other different organizations. But my interest is really in mental health policy and management, and I'm really privileged this semester to be able to go to Washington, D.C. on a study abroad alternative program and really engage in my first ever research experience. So I'm gonna share some of the results from that preliminarily, and hopefully I'll be able to publish the paper soon. That's the hope, that's always the hope, right? So yeah, very excited to share what I've done so far. So I just want to start with a short little reflection in this space particularly, because I think in the mental and behavioral health field, we do not often see the full extent or impact of our work. Whether we're in research, practice, or policy, it is hard for us to know exactly how many lives we touch with the work that we do. And I think this is especially true in prevention, where we are universally prescriptive rather than cautiously reactive, right? And I think what's really important for us to remember, and it's not something that I think we always have the time or the resources for, but is just to remember that the work that we do for young people in the United States now has international implications. For better or for worse, we are a world leader when it comes to mental and behavioral health, and other countries look to us as a model, a frame of reference, and an example of what works and what doesn't. And throughout the summit, I think we have seen just some incredible policies, and I have no doubt that other countries will take notice of them, especially either on the state or the federal level. And again, just want to emphasize that while policies might be domestic in nature, their impact is global. And so gonna explore that through one specific example, and that is, again, this idea of transnational relationships for crisis intervention services. This research, the purpose was to understand the recent international movement for 3-digit national suicide prevention and mental health crisis hotlines, in particular, the use of the 988 dialing code in both the United States and Canada. And I don't know if a lot of people know, but the United States launched 988 in 2022, and Canada followed suit in 2023. And I only found out about that 3 months ago. And I am a former crisis interventionist. I volunteered on a teen crisis line for about 4 years in high school. So I was really plugged into the space, and it was so big when 988 was enacted. And then to hear that Canada had did so, but that the conversation was not in the United States, was really interesting to me. And I think it kind of suggested a sort of unidirectionalism in that Canada was probably talking about the United States a lot more than the United States was talking about Canada, right? So that's what kind of established the preliminary view. there. But just to kind of reinforce why this idea is so important, three-digit hotlines are an approach to global youth suicide prevention. And one of the first reasons for that is that they are just easy to remember. We know that when an individual is in crisis, it can be so hard to remember a 10-digit number. The Substance Abuse and Mental Health Services Administration, SAMHSA, said that cognitive access during a time of crisis is critical and impacted by the complexity of the information needed to be remembered. I think we can think of this in terms of 911. Even in the event of an emergency, the person who is affected and the person who is responding both know who to go to for support, right? It rolls off the tongue, and it is something that is just so widely dispersible and widely remembered. That again leads me into the second point. We teach about 911 as soon as birth. We talk about it early and consistently everywhere, at home, school, work, and even online. And it's honestly just an assumption that everyone knows about it. And what the really cool thing is that in the space, 988 can be our 911 for the brain. That's some of the branding that SAMHSA has used recently. The third reason is that these three-digit hotlines are typically universally available. Anyone, anywhere in the United States can call 911 for help. It doesn't matter if you travel from one state to another, the number is the same and the response is the same. And the fourth reason is just that they are free to use. I think this is especially important in the mental and behavioral health space, where it often, young people face these roadblocks of being able to pay for services. For better or for worse, there are, these crisis hotlines are kind of the first layer of response for a lot of people experiencing a mental and behavioral health crisis. And I think even more so for young people who don't want to have to navigate insurance or ask their parents for help. They can do this from the comfort of their own phone. They can call, text, chat, and get into contact with someone who can listen to them and help them navigate the challenges that they're facing. So before we had 988, we had two numbers. We had the 1-800-SUICIDE number, 1-800-784-2433, which was started in 2001. It did operate before then, but 2001 was really when it received the first federal funding from the government to act as this sort of national crisis response model. And then in 2005, that number was discontinued, and they launched 1-800-273-TALK, which became known as the National Suicide Prevention Line for, upwards of like almost 2 decades. So you had both of these two numbers, and it didn't matter because even though they discontinued this one, if you called it, you would still be rerouted to 1-800-273-TALK. So that was basically just because it takes a lot of time and money to reinvent and reestablish a crisis hotline when you put it out into the area. That's something that factored a lot into some of the arguments had later for 988, but just know these were the two main options that people had until 2022. And again, this is really leading to the heart of my research. So I was really interested in why Canada had used the same 988 number as the United States, because it felt like more than a coincidence, right? It seemed to just show some signs of being related, and that there might have been a causal relationship at play. And you can even see in the names, right? 988 Suicide and Crisis Lifeline, 988 Suicide and Crisis Helpline. So they are virtually the same service. They operate in the same way. They're both, mainly they all go to the local crisis call center. So it's not like a centralized service. It is very decentralized, and that allows for, say when a person travels from like one state to another, they're going to get in contact with a crisis center in that area. Versus another one. There is still some debate right now about what that means for like geo-routing. That's basically, again, making sure that when you call, say like I have a 541 number from Oregon. If I'm in Maryland and I call the suicide prevention line, I'm gonna get in contact with someone in Oregon just because that's kind of how it's routed. But we're really trying to make sure that it's based on like the location of the phone rather than the number that you have, if that makes sense. And so yeah, kind of going about this, me personally, I love to jump to conclusions. And so I really had to back that up with some sort of evidence of plausibility. So again, just gonna run through this real quick. Both hotlines use the same three-digit number for a national suicide prevention and mental health crisis hotline. Canada adopted the same three-digit code as the United States soon after the United States did. And most importantly, and what we're going to explore quite a bit today, all the foundational documents for Canada's adoption involve indirect and direct references to the United States' lifeline. And especially in government documents, having references to another country's systems, operations, anything like that is a pretty big deal, in my opinion. So we're going to explore how that directly led to these plausible cases of influence. So we're going to start by just examining the United States' movement, and I'll talk briefly about my methodology. So I use both autoethnographic and grounded theory methods to really capture the contours of the actions taken at the federal level to establish the lifeline. I didn't really have the time within my semester to explore the social movement behind each lifeline, but it was really important to me to just analyze how this is taken at a federal level and then put into law, especially as a policy. I collected and analyzed these documents simultaneously to allow for free-form thematic exploration. So it basically just means it was really hard for me to keep track of everything because I was going to like different document. So it took a while for me to kind of collate all of those thoughts and things together at the same time. And again, since this research focuses primarily on Canada, I detail only briefly in this presentation the recent movement in the United States. But the first national movement in the United States was the National Suicide Hotline Designation Act of 2018. That basically launched a feasibility study into a potential three-digit dialing codes. So those are N11 and non-N11 codes, and we'll talk about what those mean in the next slide. But basically, the federal government had to look into what does it mean to have a three-digit code in particular. And it also forced coordination between the Federal Communications Commission, the FCC, SAMHSA, the Department of Veteran Affairs, the VA, and the North American Numbering Council, which seems just kind of like this omnipresent figure that just has a really big role in the way that we operate our lives. So I'm kind of excited to detail that because I think it is kind of interesting. And it required an internal review of service effectiveness too. So Congress wanted to know before they designated 988 or some other three-digit code for this service that it was actually working and that it was delivering on what it purported to be able to do. So let's talk a little bit about the North American Numbering Plan. This is basically why our phone numbers look the way that they do. So you can see that they start with a +1. That's the ITC country code. So especially when you're like international, say you're going on like a trip somewhere and you have to press +1, that's the reason why. It's rerouting to the United States, to Canada, to basically those in the northern hemisphere. And then the first three digits of your phone number are called the numbering plan area code, abbreviated for MPA. And that can start with it's in the format NXX. N is any digit 2 through 9, and X is any digit 0 through 9. So three-digit area codes, I think everyone knows that. You can say like, I see a lot of people in their Instagram piles put like, oh, I'm from like the 541, and that's like, you know, it's like a cute little thing. The next three number, honestly, the rest of the number isn't that important. We'll dive more into the rest of the NPA. So we have another term called the ERC. That stands for an easily recognizable NPA code. That's basically something that has the format N and then XX, where X is the same number. So you can think of something as like 288 or 499 or 322, something like that. And then we have N11 codes after that. And so those are really special cases of NPAs, and basically in that like no other number can operate and have like the N11 code in it. So there's not a phone number that's like 911-784. That just doesn't happen, right? It is a specific three-digit code that is basically mandated by this plan. And in their deliberations, they were having to consider N11 codes and then potential three-digit alternatives. Yeah. So this was actually really interesting for me to explore because I didn't know that there were so many N11 codes outside of 911. But you can kind of see that they were basically all established already. So in Congress mandating that the Federal Communications Commission look at all of these N11 codes, there were this kind of assumption that we would have to repurpose or share an N11 code with another service. That became really, really confusing because I don't know if you can see, but these numbers are widely used. They receive so many contacts each year. And if we were going to repurpose one, say if we were going to repurpose 611, we would have to route all of those, what is that? I can't even read that number, it's so big. We would have to reroute all of those codes somewhere else. And that is not only expensive because you have to switch the servicer that's doing that, it's also confusing because rebranding is difficult. We still hear 1-800-SUICIDE and 1-800-273-TALK all the time. So it takes a while to get people kind of up to speed with that. And it's also, again, just operationally a nightmare. Like, who wants to deal with figuring that out? So the FCC was basically like, we're not going to do that because that is just so much work. Go to the next one. And so they had to submit a report basically on the feasibility study. So they had to kind of release all their findings, and they decided that they were not going to use an M11 code at all. They also disagreed in sharing a number with sharing a number with another service. So they basically said, we can't share this suicide prevention and mental health crisis hotline with 911 because at the core, they perform foundationally different services, right? Like 911 is a dispatch and response model, whereas like 988, I think, is like a problem identification and then helping you figure out how to develop a self-care plan or something to that extent, right? They are just too foundationally different to be able to share a code, and the FCC agreed on all of the N11 codes for that. And they also had to weigh the cost of then using a non-N11 code. So if we're not going to use an N11, what does it mean for us then now? And so they decided that this is kind of tricky, but basically when you designate a non-M11 code, it can't be used as like a numbering code after that. So if this was going to be a specific 3-digit service, then it couldn't also be like a full standard 10-digit number. So that was really, really tricky because it meant that if we took an area code that's not assigned right now, we would essentially eliminate 4,782,969 possible phone numbers with that. And I don't know, that sounds like a kind of a scary number. And it's just important to know because the North American numbering plan is a finite resource. Like, we can't make more numbers appear out of thin air. That's all we have. And that's all we will have in the future. So if they decided to designate 988, which they did, and they eliminate all these numbers, they would just have to be very aware and conscious of that. And another really cool thing that the FCC staff report did was that they had to do a cost-benefit analysis. And I think this is something, can you go back real quick? A cost-benefit analysis. And so that's basically, if we were to implement the Lifeline, will it actually outweigh the cost that it's having associated with it? So they predicted that it would cost $570 million just the first year to switch to a non-N11 code. And to kind of justify that, we go back to this argument of this. It's really an argument rooted in public health, but it's one that's like, how much does suicide, depression, and other mental health disorders present as an economic burden on the country, right? We know that it decreases labor productivity because people have to take time off of work to heal and recover. And it also just, these disorders are expensive. And I think we heard that in some of the other policy presentations. But they used this measurement called the value of a statistical life. And that's basically how much people bet on their own safety. And at the time, that was appraised at $9 million. So that means each of us are probably willing throughout the span of our life to invest $9 million into our own health and safety. And the FCC estimated that if the Lifeline was successful at decreasing suicide mortality risk by at least 0.13% its first year and 0.04% its second, the financial benefits would outweigh the cost. And basically, that means all that the Lifeline had to do was save 60 lives to cover the initial costs. And I don't know, that's such a small number, right? When we think about how many people, the millions and millions of contacts to the hotline, that is an incredibly, incredibly low number. So just keeping that into consideration as well. And then with this report, the FCC actually designated 988 as the nation's national suicide prevention and mental health crisis hotline. And we can go to the next slide. The National Suicide Hotline Designation Act of 2020 gets more attention, but the FCC was basically the early adopter. They got all of their attention and publicity stolen from them because Congress was like, oh, I need the attention on me. But basically, again, it's just reinforcing the FCC's regulatory decision, and it also allowed states to collect a fee to fund the 988 Suicide and Crisis Lifeline. That basically just means, I think in Oregon, I'm trying to think, Washington has a law right now where they collect 5 cents on your phone bill from every resident to help fund in part this service. So we'll likely see a lot more of those laws passed nationally as well. And just to give you a review, on its 1-year anniversary, the Lifeline experienced a 46% increase in calls, a 141% increase in chats, and a 1,135% increase in texts. And in specific, the text is really, really important because who do you think was texting the crisis line the most, right? The data that we have doesn't disaggregate based on age in specific, and it's kind of hard to find that numbers, but we can assume that the Lifeline was experiencing a lot more contact volume from young people, which is just really important to set the stage. Okay, now we'll go into Canada. So this is really interesting. Canada's federal movement started more than a decade before the United States. In 2006, the Canadian Association for Suicide Prevention applied to designate 511, the last unassigned 911 code in Canada at the time, as the National Suicide Prevention and Mental Health Crisis Hotline. And CASP's application competed with one from basically a weather channel, which aimed to designate 511 as a weather and traveler information service. So you could call this get an update about the weather outdoor, if the roads are safe to go out. And to determine which application to select, the Canadian Radio, Television, and Telecommunications Commission, that's basically the Canadian equivalent of the FCC, evaluated along criteria it had developed in a 2001 decision for the allocation of remaining 911 codes. And one of those criterion was that there must be a compelling need for 3-digit access that cannot be satisfied by other dialing arrangements, or it is demonstrated that existing dialing arrangements are not suitable for accessing the needed services. Ultimately, the CRTC determined that there was already a suitable alternative, namely the 1-800-SUICIDE number in the United States. They actually directly reference it in their decision. And another kind of, to add on to their denial, the CRTC believed that there was an overlap in service provision with the 211 code. And the 211 is basically community information and referral services. So that was created by United Way. I don't know if many people here know what United Way does, but they've really been a big proponent of the 211 code. And they were basically arguing, we can do that work. We can respond to suicide prevention calls and everything like that. They couldn't. That's just not within their roles. Again, it's really a story of roles. What does it mean to actually be a crisis interventionist? What does it mean to be a caller as well? And so that's actually an argument that appeared in the United States more than a decade later when FCC was going through all of its conversations. And I just really think that this was one of the first and earliest pieces of evidence of United States influence. The fact that the CRTC identified the 1-800-SUICIDE number in the United States and framed it in such a manner as to state precedents, to say that because we have this, we don't need to decide on something else, and then used it to reason against the proposed M11 alternative, provides support for a sort of watch and follow relationship. So we see Canada at the time following the lead of the United States as it related to crisis intervention services. And I also found no online documentation that listed a particular reason why 1-800-SUICIDE was also used in Canada. So that was used in 2003. That's when it was first launched. And that's 2 years after the United States had launched the code. So I don't have any conclusive evidence, but if anyone is connecting the dots like me, that points to Canada already taking the lead and kind of stealing that number as well. And so that kind of leads us to this really cool movement. So after then you can switch it. Yeah, thank you. After that, we have these two really consequential motions. So we have a petition from a Canadian mental health activist, Maddie Muggeridge, which was released just 4 days after the FCC designated 988. Just 4 days, 4. And that basically read, I'll just read the description real quick, just so people get it. This July, U.S. Federal Communications Commission 5 leaders voted unanimously to begin putting the 988 number into effect for mental health emergencies. In 2022, U.S. citizens will be able to call 988 and receive help when in crisis. This is expected to save lives by giving an easier and more convenient number to call 911, or call to similar to 911. I want to see Canadian politicians follow in America's footsteps to implement the 988 hotline or another 3-digit emergency number to take a stand against suicide. And there's some other stuff there, but really not that important. Within a few months, that petition amassed over 35,000 signatures from individuals across Canada. And it really became a force and testament to the movement itself, because it had been tabled for essentially 2 decades, because Canada was like, we're not gonna make a move until the United States does. So this is kind of one of the main pieces and one of the main causes that I outline in this research, is just that the United States brought heightened attention to Canada's movement, undeniably so. And so that leads us into this non-binding motion passed unanimously in the House of Commons. That was from Todd Doherty. He's a MP from like Prince George, Caribou area. I'm not really familiar on Canadian geography, but that non-binding motion read that given the alarming rate of suicide in Canada constitutes a national health crisis, the House call on the government to take immediate action to establish a national suicide prevention hotline that consolidates all suicide crisis numbers into one easy to remember 3-digit, in parentheses, 988 hotline that is accessible to all Canadians. So again, we see this direct reference, and you can see here, I didn't point it out first, but we have a reference count. That's a little counter of how many times the United States is directly appearing in these official government documents, right? And so all of this leads us to one of the most important pieces of Canada's movement, which is a report from the Mental Health Commission of Canada. That was a nonprofit organization established and funded by the Canadian government in 2007. And they basically they were assessing international models of 3-digit suicide prevention and mental health crisis hotlines. And at the time, it was just the United States and also the Netherlands, which had launched 113, kind of as an alternative to that. We can get into that later. But they were basically reviewing that, and they found that the United States had really created the infrastructure for a non-911 code, right? Because they did this, because they took 988 from the North American numbering plan and designated that as the National Suicide Prevention Code, Canada could basically just piggyback off of that. They wouldn't have to go through the same discussions of like, do we repurpose an 911 code? Do we share it with another place? They were just like, let's just get to the ground running and do it right now. And they also, I think a really interesting thing is that they noted a lot of similarities in need and use of suicide prevention and mental health crisis hotline services. So they directly in this document, mind you, they're like, well, the United States is doing a lot of public advertisement around 988. That's something that we can piggyback off of and just kind of use the momentum that's already there to help inform our Canadian citizens and kind of jumpstart their public education effort. They also said that we share borders. So when people cross and like come and go from Canada to the United States, there is still a need to establish a sort of continuum there, because you don't want someone going into Canada and then not knowing what the like National Suicide Prevention and Mental Health Crisis Hotline is, right? It just seems like a really great opportunity to make this sort of North American solidarity for this number. And they basically said, we're experiencing the same alarming rates of suicide, depression, and other mental health challenges, so the need for this service is virtually the same. And so the Canadian FCC counterpart, perfect, okay. The CRTC basically launches a notice of consultation, and that's just to request public comment and opinion on the topic of a three-digit number. And they expressed a preliminary view that any decision should follow the same criteria used in CRTC 2006-44, which is the one that the original application from the Canadian Association for Suicide Prevention, CASP, had failed on. So that was coming back, does this movement finally make the test, right? And they just noted some of the same issues that the United States did. But on that specific condition that the prior application had failed on before, the CRTC said this time yes. And they cite the increasing rates of the mental health crises and the fact that the United States had since transitioned away from 1-800-SUICIDE and 1-800-273-TALK. They said, again, it would be too costly to repurpose or share an M11 code with another service. And there was also some discussion because I guess in some places there is 7-digit dialing, so that means you don't have to put in the first three, that you don't have to put in your NPA when you're calling someone. It's just automatically routed in your phone. So they were trying to figure out, okay, well, we have to move to a 10-digit number so that it all follows the same kind of format so we're able to actually do this. And then we can go one more. Unsurprisingly, in CRTC 2022-234, Canada designated 988 as the National Suicide Prevention and Mental Health Crisis Hotline. And what are we at right now? 44 references, 54, oh, even more. That's like really incredible when we're talking about like international relations. So just keeping that in mind, they basically note it and are like, okay, we agree with the United States here. Go. And so this is my proposed model. I'll run through it really quickly, but we might have had some possible influence from Canada because they were like the first ones to take a federal action for a 3-digit line. That might have informed the United States. But basically, after the United States passed 988, they brought heightened attention, and then they brought new infrastructure, which were used in all of those kind of steps that I outlined, previously. All right. And then I'll just quickly run through this. This is really important because we have a causal relationship established. We can say now that other countries, part of the North American numbering plan, because it's not just the United States and Canada, it's also Trinidad, Tobago, the Caribbean, so many other places. We can say that other countries now can follow Canada's example and adopt the United States' model as an approach to global youth suicide prevention. So we're seeing this come back and make a full circle, right? We're seeing how this can now be used to really save lives in countries so far away, all because the United States had been the first to kind of move on it. One more. And on my final slide, I just want to share, again, this is a really complex relationship. It's still developing research, but this is really important because it shows that state and federal policies can serve as models for other countries. And so if we embed equity to make sure that the services that we're doing are actually meeting the needs of the people that are most disadvantaged and in most need, and if we prioritize generalizability so that it can be applied to many people universally all at once, and if we talk about youth engagement, if we make sure that the service is actually built for youth, and if we involve youth into that, then we can impact an incredibly great number of young people, both directly and indirectly. Because this is something I don't think any of us could have foreseen the impact that this would have abroad. So it has been really cool to kind of go through that now. And really excited to share this research with you. I'm happy to take questions and answers later. You can skip through the next 3 slides. Oh, this was, okay, can you go back? If anyone, this is just a little reminder for yourself. Can you actually remember one or both numbers previously used for 988, and can you spit it out right now? Yeah, I see nods, no, no, no. Exactly, exactly. Okay, and then you can go through the next 3. And this is my contact information. I'd be happy to share the research paper when it's out with, when I finally publish it. So thank you so much.
All right, thank you so much, Trace. You're always an icon, inspiration, so appreciate all the work that you're doing, and I never thought I'd be so interested in phone numbers, so thank you so much.